Now let's talk to Partnership and Grants Officer Wellbeing Foundation Africa, Tosin Adebayo, for more on the World Health Day observance. We're less than 10 years to the 2030 SDG 3 target. What do you consider to be perhaps the biggest challenge for Nigeria to achieve wealth and well-being for all?
Yeah, hello. Good evening.
Good evening.
Thank you so much for having me on the news. Really, in Nigerians today, the biggest challenge in healthcare is the prioritization of people having access to equitable healthcare system in Nigeria today. And I'll happily like to let you know that today is the World Health Day, and this is also the day where we celebrate the global anniversary for World Health. Today's global theme is our planet and our health. And even in the midst of the COVID-19 pandemic, which has also proven to be an issue today, which we say is a problem in Nigeria and around the world. You know, in the midst of the pandemic, there's a polluted planet, increasing diseases like cancer, asthma, heart disease, and that is why the WHO is focusing its global attention on urgent actions needed to keep humans and planets healthy and foster a movement to create societies focused on well-being.
Absolutely.
Thank you.
Perhaps what do you think that stakeholders in Nigeria can do better to bridge the gap between healthcare provision and indeed the number of people who need to access them?
Yeah, exactly. It's, you know, bridging the gap, it deals more when coming collaboration and partnership, multi-sectoral collaboration between the government, the NGOs and the private sectors. And when I'm talking the government, I'm talking about the nurses, the midwives, I'm talking about the governmental agencies, all of them coming together, especially the private sector too, and especially the non-governmental organization sector. And what can we do to bridge this gap? Now, I would like you to know that since Monday, Wellbeing Foundation Africa has also been engaging in collaboration with the Liverpool School of Hygiene and Tropical Medicine Center for Maternal Newborn Health and the Johnson & Johnson. And my Wellbeing Foundation Africa is also engaging with Medicaid Cancer Foundation, the Real Visionaries Initiative, and the State and Federal Mental Health with midwifery oncology stakeholders to create a roadmap to endanger a much more needed pathway to integrate upskilling health professionals, and this session is being hosted in two geopolitical zones, in the southwest and the north central zone of Nigeria. Since Monday, we're in Abuja, where we brought in multi-sectoral partnership with different persons, where we had directors from various organizations, such as the head of nursing, director of nursing. So we brought them to discuss within the studios. The first day was on Monday, and Tuesday was in Abuja, and we're also here in Lagos, which held on Thursday, which is today, and will be holding on Friday, tomorrow too. So we are discussing and to create a pathway. And I would like you to know that we cannot improve healthcare system without prioritizing the frontline health workers. Who are the frontline health workers? I'm talking of the nurses and the midwives. Those are the people at the front line. And one of the beautiful things about this stakeholder workshop is, and where it's been our innovation, is we are bringing in three thematic areas. We are looking at the oncology nursing, we are looking at mental health nursing, and we're also looking at midwifery nursing. So, because the truth is, they have been under prioritized for many years, and I will happily let you know that the way Nigeria is today, if we don't sit together, collaborate, work together in partnership, Nigeria wouldn't move forward in its health sector. Thank you.
Tosin Adebayo is Partnership and Grants Officer, Wellbeing Foundation Africa. Thank you for talking to us tonight.